Okay, this is me treating my back. That has gone out ever since the 70s. I used to wrestle. I did a flip, tried to do a pancake and felt my back pop, and it's been bothering me since the 70s. And I've been working on it ever since then. Well, ever since maybe 15 years ago. It goes out every now and then, and this is the treatment that I do. So this is some serum needles, my favorite, for doing this because they are, and I'll post it. Here's the box. Serum needles. For some reason, they're a lot smoother. I call them, they have pillow tips because they're nicer and easier to use on a repeated basis, like what I'm getting ready to do. So I just put it in and I just kind of move it around. And what I do is I pull, oh, it just bent. See, it bends. You can still use it, but you just have to modify it. That would hurt a little bit, a little zing. And yeah, it's done. Open another one. And it comes in a tube. And you can pop the tube. It's got a little well to it. You have to unlock it, and then you hold it like that. And I flip it around like that, and I aim it wherever I want it to go. And push it in. And then relax. And it bent and feel. So it feels nothing. Don't feel anything. So, but it didn't bend that bad. Sometimes if you don't push it in, if you push it in too quickly, it'll bend. Move it up a little bit. And I'm holding it like this. So I can maneuver it. There's nothing there. You think you know where the spot is, but you don't. So you have to go looking for it. That bent too. So I will do another video with a thicker needle. But on any account, let me finish this up. And excuse my little beard pudge. Go down a little bit. And there's nothing here except bone. And you see I push it in all the way because there's nothing there. It'll bottom out on the bone and it'll just stop. Oh, there's a good spot there. But you don't know until you get there. This is acupuncture. Touch, it's touch and feel. You don't know until you do. And the patient will tell you, that's the spot, that's the spot. And there's hundreds of them. There's hundreds of them. And you, see that one bent again. I'll use a thicker needle. And then you stretch. If you don't stretch, it'll lock back up again. And thank you very much.